Hello, my name is Muzaffar. I'm a fifth course medical student. In this video, I'm going to demonstrate communication skills in a patient with a history of hypertension. Also, at the end of this video, we will demonstrate principles of auscultation of heart. Hello, my name is Muzaffar. What's your name?
Shaukat Ali.
How old are you, Shaukat?
I'm 23.
Shaukat, can you tell me what has brought you to our clinic today?
I recently moved here. I used to live in the neighboring city. After quarantine, I moved here. I have a history of hypertension,
Mm-hmm.
so it's like a regular checkup.
Mm-hmm. So, can you tell me about your history of hypertension? How long you have this hypertension?
About 2 years.
About 2 years. You have a 2 year history of the blood pressure.
Yeah.
So, can you describe me what symptoms recently do you have?
Headache.
Headache.
Yeah.
What's the location of this headache?
Usually in the back of my head.
In the back of your head.
Yeah.
What's the intensity? If I will give you a scale from 0 to 10, what's the intensity of pain, headache?
7 mostly.
7 mostly. And duration?
About an hour, half an hour.
Half an hour. So let's first of all assess your quality of life. Is it comfortable for you if
Yeah.
I will ask some questions for you?
Yes.
Okay. Tell me about your height. What's your height?
160.
160. And what's about your weight?
65.
65. Now, tell me, do you use any kind of sports or exercise?
No. Just a few.
Is it like you are having a sedentary lifestyle?
Yes.
Okay. So now tell me about your family. In your family, do you have any history of any disease?
Yeah, well, my grandpa died of kidney disease.
Kidney disease,
Yeah.
chronic kidney disease.
Yeah.
Okay. Do anyone has any hypertension, diabetes, or
No.
any metabolic disorder in your
No.
family?
No.
Absolutely fine from that.
Mm.
So, what about your diet habits? What things usually do you take?
Actually, I don't have much time for cooking, so I usually go for the fast food.
Fast foods.
Yeah.
And what about your drinks like alcohol? Do you drink alcohol?
No,
And what about coffee?
a lot.
A lot.
Yeah.
Can you describe me how many cups do you take?
3 to 4.
3 to
Sometimes
4.
more.
Sometimes more.
Yeah.
On average, 4.
Yeah.
On average, 4. So, what about your salt? How much intake of salt do you think you take?
I like salty food. So
You like salty
yeah,
foods.
I take a lot.
You take a lot. And what about your sleep cycle?
It's really bad. 3 to 4 hours maximum.
On average, 3 to 4 hours
Yeah.
per day.
Yeah.
Okay, 3 to 4 hours per day. Um, do you have smoking history? Do you smoke?
Yes, a lot, quite a lot.
Quite a lot. How many cigarettes do you smoke on average?
Most probably 20.
Most probably 20 cigarettes a day. It's like a one packet.
Yeah.
One packet a day. What about your family? Financial, family, sports. Do you have any kind of turbulence in your family, like any problems?
No, it's usually stable.
What about your anxiety and quality of life? How can you describe your satisfaction with the life?
Well, actually, I'm a fourth course medical student,
Mhm.
so life is kind of very stressful.
Mm-hmm.
So I think it's sedentary lifestyle plus stress, and that's what is giving me hypertension.
Have you done any kind of examination before?
Yeah, I have bought the recent reports with me. Here.
Okay, thank you. So you have done blood analysis, urine analysis, um, you have done ultrasound of kidneys and blood vessels. That's good. Okay, You have done thyroid function test also. That's also good. What's this? This is your insurance, medical insurance.
Yes.
Okay, we may also need this for you. And you have also done other kind of metabolic biochemical analysis. As far as I see, everything is normal from your all these analyses. So it means that you don't have secondary hypertension. So all we can say that your hypertension is primary hypertension. And for that, one question I would love to ask you about your history of taking hypertensive medicines. Do you take, had you?
Yes, yes. Actually, earlier I used to take medication, but lately I felt that I have resistance against them, so then I stopped taking medication.
What kind of medications you were taking for hypertension?
Captropil
And
calcium channel blockers.
it means you were taking a double therapy.
Yes.
Okay. How many pills a day?
2.
Okay. So now, as for first of all, for a further investigation, I would suggest to you ABPM, ambulatory measurement of this blood pressure, which will be done for 24 hours, which will measure your 24-hour blood pressure. First, we will do this, and also a further medication. I would suggest for you before I will do this. I will check up your blood pressure. Will that be okay for you?
Yes.
Okay. Your blood pressure right now is 145/95, and whenever you were doing a blood pressure analysis, how much was on average? How many times? I mean, as for
mostly it was the same.
145 by
145 by 95.
95.
Yes.
This is your blood pressure.
Yes.
So we will be doing a 24-hour monitoring of your blood pressure, and I will suggest a new treatment for you. It's a triple therapy. It will be, I will write it on your prescription. It will be a combination of 3 therapies, combination of 3 drugs, and the brand name for this medication for you will be Tribuzor. It's the latest, I mean, in our market right now. I think it will help you. And second thing that I will recommend you are some lifestyle changes.
Okay.
Modification of lifestyle changes. That's very, very important for you. First of all is your stress management. You have tried to get relaxed always. Don't worry about the situations. And for that, if you can, I suggest to use some kind of meditation, some kind of workings that can help your, I mean, stress management. That's absolutely, I mean, you should believe on yourself. That's very, very important. Management of stress is very important for you.
Okay.
Number second change is some dietary changes. In the dietary changes, you have to take those foods which are K positive rich. You are a medical student. I think you understand the concept very well. I will also give you a diet chart, special things that you should take. And another thing that is about salt intake. Salt, you have to take very less salt, approximately less than 2400 milligrams per day. It's very, very important for you. One more also is smoking cessation. As you smoke, if you will quit smoking, that will be very wonderful for you. Blood pressure will decrease by certain factors. So salt intake, smoking cessation, and one important additional suggestion will be exercise. Aerobic exercise you should do regularly, at least like 2-3 hours per week. So exercise you could do like walking or jogging, or also you can do swimming. You can go to sports, but try to use some cardio exercises, cardio specific exercises. That's very important for you. And else I would recommend you not to take much fatty foods, etc. Rely on fruits, vegetables, fresh stuff. That is that okay for you?
Yes, of course.
So lifestyle modification plus this therapy that I have recommended for you will be absolutely fine for you, and I hope this will help you for your um, assessment. Okay, now in another segment we will show our skill of auscultation of heart.
Go.
From here now we will show our auscultation skills in this patient. We will examine the heart sounds by our stethoscope, usually by the bell of a stethoscope. Now I'm going to examine your heart. Will it be okay for you?
Yes.
Are you feeling absolutely comfortable right now?
Yes.
Do you have any kind of pain?
No.
If it will be uncomfortable, let me know, please.
Okay.
So first point for us is, first we will locate the apex beat, which is usually on the fifth intercostal space. Okay. It's a mitral point in the fifth intercostal space. Then we will go into the second intercostal space parasternally to check about aortic point. Then on the same opposite side, pulmonary. Then at the end of a sternum, just above xiphoid process, to the little bit to the left side, pulmonary point. No, this is the tricuspid, sorry. Then between these 2 points, we will be checking for Botkin Urbs point. This is about auscultation of the heart. Thank you so much.